Welcome back Sunbro. We hope you all in great health and great money. Today we are going to talk about 5 diseases that might develop as a result of not brushing your teeth. Not brushing your teeth results in more than just poor breath. Poor oral and dental hygiene may raise the risk of dementia and heart disease, and if untreated, can result in many more serious illnesses such as cavities, gingivitis, and periodontitis. Diseases brought on by improper tooth brushing. Dental and oral health issues might develop from irregular tooth brushing. There are at least 5 diseases that can develop as a result of not brushing your teeth, including cavities. One of the most prevalent diseases brought on by not brushing your teeth is tooth decay. If you don't wash your teeth often, plaque will accumulate on the surface of your teeth. Bacteria-filled plaque is a coating that can result in cavities. Since plaque is easily cleaned with a toothbrush, cavities are actually fairly avoidable. When a tooth is cavity-ridden, the toothbrush is no longer able to make the teeth healthy once more. Therefore, before the hole gets bigger, you should visit the dentist right away to discuss this situation. If tooth decay is not addressed right away, it may become infected and cause you to lose your tooth, since it cannot be saved and thus must be extracted. Gingivitis. The accumulation of plaque on the teeth, which eventually hardens into tartar, is another factor in the development of gingivitis, or gum inflammation. Therefore, due to the inflammation you experience when you don't clean your teeth frequently, your gums may easily swell and bleed. Gingivitis can worsen and develop into periodontitis, an infection of the tissues supporting the teeth, if left untreated. Periodontitis. When gingivitis is not adequately treated, it might progress to periodontitis. This is a serious infection that impacts the tooth-supporting bone as well as other tissues, like the cementum. In the end, periodontitis may be the primary factor in tooth loss. Dementia and lowered cognitive function. While not brushing your teeth is not a direct cause of dementia, there is a link between oral health and cognitive disorders in the elderly that has been established by science. According to the National Institute on Aging, dementia and cognitive decline are more likely to occur the more teeth are lost as people age. However, elderly persons who wore dentures while losing their teeth did not experience a higher incidence of dementia than those who did not. Uncertainty still exists over the precise cause of the link between tooth loss and the likelihood of cognitive deterioration. However, this may be connected to the effects of tooth loss and poor dental hygiene on general health. Specifically, missing teeth might result in masticatory issues that interfere with the digestion of food, chemical imbalances, or brain alterations that ultimately impair brain function. Gum disease and an increase in oral bacteria are both caused by poor oral hygiene. This disorder may lead to inflammation and raise the possibility of dementia, causing beta amyloid plaques in the brain. The converse possibility also exists, namely that tooth loss may be a precursor to cognitive decline. The cause is that patients with impaired cognitive function may have a propensity to neglect oral care, leading to tooth loss. Heart disease. Until now, there hasn't been enough solid scientific proof to back up the idea that having bad teeth can lead to heart disease. Similarly, it has not been demonstrated that treating gum disease lowers the risk of heart disease. Many studies have found some associations between dental and cardiovascular health, including a higher risk of heart disease has been linked to periodontitis. The relationship between tooth loss patterns and coronary heart disease. Poor dental care can increase the risk of bloodstream bacterial infections that can harm heart valves. Therefore, whether you have heart valve issues or use artificial heart valves, it is crucial to pay attention to your oral health. Diabetes and cardiovascular disease have a close connection. On the other side, there is evidence that treating periodontal tissue may be advantageous for diabetics. How to properly wash your teeth to prevent disease. How to brush your teeth effectively and correctly is also important to take into account in order to maintain and keep your mouth and teeth clean and free from disease. The following is the proper brushing technique. Place the toothbrush at a 45-degree angle from the gums. Gently move the brush in a circular motion back and forth in short, tooth width, movements. Brush the teeth's chewing, inner, and exterior surfaces completely. Hold the brush vertically and use numerous upward and downward strokes to clean the inside of the front teeth. There are a number of considerations you should make in order to maximize toothbrush outcomes, including: use a soft bristled brush that is the right size and shape for your mouth to reach all areas of your mouth at least twice a day to brush your teeth. Every 3 to 4 months, switch out your toothbrush. If the bristles no longer look tidy, you might need to replace it sooner. An old toothbrush won't be able to effectively clean teeth. Make use of fluoride toothpaste. You must also follow an extensive regimen of additional dental care procedures in order to prevent the negative effects of not brushing your teeth, such as using dental floss once a day to clean in between the teeth. Eat a balanced diet and avoid or restrict sugary drinks and snacks. Visit the dentist at least once every 6 months. One should not underestimate the effects of not cleaning one's teeth. Even though they may seem unimportant, oral health issues like toothaches and gum disease can seriously disrupt your daily routine and cause severe discomfort. Thanks for watching Sunbro. Please subscribe, like, comment, and share if you find this helpful. Come again to our next meeting, Sunbro.